Let's just say that.
Okay. Well, I'm glad you did. It was timely because we do like to get our community partners involved through these meetings. We usually do this face to face, by the way, with food, but we're going to do.
I understand completely, and I'm glad that your organization is I'm aware of your organization now, because I think I'm on a similar path.
Oh, well, that's good. Well, maybe we'll be on the path together. It's this was a little bit late to have this meeting. We usually do it right in the beginning of September, but learning a new email system. I don't know if you got my fancy email. I had to learn how to do that. So
that's okay. I understand.
Took me a little while to get up to speed. So.
Okay. It's okay, because Chantal and I had just connected, and I was presenting to her, so I'm sure she just forgot to mention that when we were exchanging information back and forth.
Oh, well, I'm glad she remembered. She emailed me and she said, oh, I forgot to tell you about this person. So did you get an email from Growth at UNCG? Do you remember?
I did.
Okay, because I added you. I'm still learning the system, so I added you to the list. I'm glad to know it worked.
You're doing better than what I am, because I have to contact someone about getting my website together. So I'm very, very at the bottom beginning of the formulation.
And this is a new business or a new nonprofit? What are
it
you
is
doing?
A new nonprofit. So I was a Medicaid worker, and I did specifically Medicaid for those entering assisted living and some folks going into long-term care. So I got a different perspective, a completely different perspective. And I'm not really from North Carolina.
You're what?
I'm not from North Carolina.
Oh, here we have another new person. Scott is coming in.
Good.
I guess newbies show up early.
Don't want to miss any of the fireworks.
Yeah, that's right. Hello, Scott. Can you hear us?
Yes, I'm just getting dialed in.
That's fine. You're early. We're just
testing my system, so I can go back on mute if you still have work to do.
I think I recognize you. Have we met in person?
Possibly. I've been out in the community talking about stuff, clinical research.
That may be where.
Yes.
Well, so far it's just you, me, and Roberta, but there are others I'm sure are coming. So
How many normally join?
Well, we usually have a Zoom screen full plus.
Okay.
When we do it face to face and serve food, we get a lot more people. And hopefully we'll be doing that sometime in the spring. This is, it's I keep thinking we're going to unpivot and then we repivot.
Yeah.
So,
yeah.
It's but Scott, what is your last name? It's Witt.
Witt, W-H-I-T-T.
All right. What is that painting behind you? It looks like a Van Gogh or something.
No, it's one of our subjects painted that, and we have it in the clinic.
Wow.
Yeah.
Very Van Gogh-y.
I know, very Van Gogh-y. I like that. Yes.
Roberta and I were just talking about assisted living, and my mom was in assisted living for a while, and this man across the hallway from her said to me, would you mind if I gave your mother a drawing? And I envisioned, something done, arts and craftsy thing. And
Right.
he had drawn this amazing plant with all these intricate little flowers.
Wow.
And then I Googled him when I got home and found out he was a really well-known artist. And I had left this thing on my mother's food tray. Right?
Oh my
And I
gosh.
ran back and got it.
Oh, good. You got it. That's very good. I'm a
So-
fan of Antiques Roadshow. Just when I used to travel a lot for work when I was a consultant. That was a great way to wind down the hotel room. And I always love those stories.
Yeah, I'm just gonna step to the bathroom for a minute. So I'll be right back. No one else is waiting to be admitted right at this second, so I'll be
Okay.
back.
Now, Scott, what do you do?
I have a medical research, a clinical trial site here in Greensboro.
Okay, okay.
We do
Okay.
clinical trials in a wide range of areas. We're just about to launch a couple of Alzheimer's treatment and prevention trials for new drugs in development. So we're looking for people to help us and for people to join.
Very good, very good.
How about you?
I resigned from being a Medicaid caseworker, and I have started a nonprofit targeting specifically issues with African American older adults.
Sure.
And that's clinical trials always get me. I'm the clinical trial person. Whenever I go to the doctor, I'm the hated patient because I always say, well, how many African Americans participate in clinical trials? Because I need that information because I'm not too sure that prescription's going to work on me. And normally, I thank God that I have 2 physicians in my life that just love me. And they're like, okay, Roberta, there's statistics on this, but there aren't too many statistics on that.
So that is watched very carefully now, and we have historically we've been around for about 15 years. We're across the country one of the higher sites in terms of diversity.
Very
We've just
good.
always been very, very encouraging and very welcoming, and we deal with that question quite a bit. But
And I'm grateful for that because it's a big issue and people still don't understand. And I look at things from a holistic perspective in regards to diet and environment and what you're putting in your system and how it affects everything. And a lot of I don't want to say a lot, but previously a lot of researchers never took that into consideration. But now that we're dealing with a lot of environmental issues and we're actually identifying health disparities as a public health issue, it makes it a lot more significant to get that information.
It does. It does. We make a very conscious effort. We have a lot of specific materials for reaching out to the African American community to get them involved in trials. We spend time in senior centers. We do well, I would say, depending on the study and the disease and the indication. We're probably 40 to 60% African American participants in the trials that we run. Yeah,
that's excellent. That
very
is
important.
Hey, David and everybody, we're just chatting until maybe a couple minutes after 5 to give more people a chance to join us. So chat away.
Okay, good. Well, it's good to be on. Thanks for having me. Scott, good to see you, brother.
David, same here. Hope you're doing well.
Hi, Chantel. Yeah, doing well. Thank you.
Good afternoon. I'm sorry I'm driving. I wanted to get in here before you all got to see me cuss at the people on the road.
Well, I could be entertaining. Maybe I'd learn a lesson. That's what I do. I learned to drive in Washington, D.C. and Boston.
Yes, I'm from Pittsburgh, so everywhere you go there, you have to cross a bridge.
Right. Oh,
I used to take the Broadway Limited from Chicago to New York City, and all the blues musicians would get off in Pittsburgh and the bar car would not be fun anymore. Just saying.
That's great. That's great.
Yeah.
I don't see anyone. Let's see, no one else yet. We'll wait a couple more minutes. I think it's 5 right now. So,
I may have to drop off about 40 minutes in. I gotta leave to take care of my teenagers getting out of high school.
yeah, I don't think we'll go 2 hours. I wanted to
Okay.
allow, just in case we really get into something, I wanted enough time, but,
Mm.
okay. Oops. Okay, I'm just keeping my eye on these admit buttons. Hi, Krista, how are you doing?
Hi, I'm doing pretty well, hanging in there.
Good. Okay, a couple more minutes. When we get started, I'll ask you all to mute, but for now, I don't think it matters. David, you look like you're a professional Zoomer with your headphones.
Well, we've done a lot of Zoom. I think we all have. And yeah, I just found this is the best way to, I mean, I hope you can hear me clear. It's,
Oh, yeah.
I always try to ask, but it
Okay.
helps drown out a lot of noises, outside noises anyway.
Yeah, I've had some trees down this week and I'm giving the wood away to people in my neighborhood. And I've been trying to get people to come and cut it up and take it all week. And of course, I got 3 calls right before this meeting. They wanted to be sawing wood right outside my window. It would not have worked.
Oh, wow.
Okay, well, I know I'm absolutely positive some other people are coming because I've received emails from them. Well, let me just wait 1 more minute, just in case. It's so frustrating to catch people up, so we'll see. Erica, who are you with?
So I am a student at Fordham University, and yeah, I'm an MSW student.
Very nice.
So how did you find out about this?
So one of my mother's old co-workers, I think, used to work for UNCG and just told me to join in on this. So that's why I'm here.
Okay, and here's Lisa. I knew Lisa was coming. So, okay, there are a couple people missing, I'm pretty sure are going to show up. I'll try to keep my eye on the admits. Can you see those 2, Chantel, the admits? If I get distracted, great. I made Chantel my co-host just in case my internet goes wonky or something. But let's, I'll go ahead and get started, and maybe at the end, I'll reintroduce some things. Oh, here's Matthew, that's good. Well, at least we fit nicely on the screen right now. I'm Rebecca Adams, and I coordinate the Growth Hub. The Growth stands for the Gerontology Research Outreach Workforce Development and Teaching Hub. We used to call it GRN, the Gerontology Research Network, but when I took over coordinating it, it became clear to me we did more than just talk about research, and that it was really a partnership across all those areas. I'm delighted to host our fall networking meeting. As I mentioned to some of you at the beginning, when we were just chit-chatting, we normally would do this someplace out in the community and serve food and adult beverages, but we're still pivoted and Zooming at the university for this semester. Although it's kind of mixed, you know, don't be surprised if you're invited to something on campus. I just want to give you a very brief update on a few things that are happening around gerontology and growth at the university. And then the next thing I'm going to do is call on some of you who've asked to introduce yourself and to talk about your interest in collaboration. And if there are others here with us, when we're finished with that, then we'll allow them to introduce themselves and maybe have some open discussion. One thing I want to mention, in case you haven't noticed, gerontology, the master's program, the online master's program was just accredited. And most of that credit goes to Elise Eifert, Dr. Elise Eifert, who can't be here today. But she developed the program and led us through the accreditation process. Chantel was involved too, Dr. Cairo. But Elise really, I think you would agree, Chantel, she really carried the burden for all of us. And it was really great for me after being involved in gerontology all this time to go away on research assignment and come back to an accredited program. And it gets better than that. If you look at the gerontology website, Charlitha Jordan, who provides us with staff support, sometimes has updated the gerontology website. We've also been recognized now as one of the best online programs. And I might mention that we were the second online program in the entire country to be accredited. And that's actually misleading because the first one that was accredited was the pilot program that they developed the accreditation standards. You know, they went through it, made sure everything went smoothly. And that's the program at UCLA. So there was no question about whether that was going to be accredited. It's been around for a long time. So in some ways, we're the first to go through this process and to be successfully accredited. And that's really awesome for UNCG and for our larger community. I also want to mention, and I'll mention this again later, we're going to be inviting you back on November 17th. In addition, only that one will be, I can't remember if it's at noon or 12:30, but it's at lunchtime. Normally that would be a lunch and learn, and we would be in Stone Building sharing box lunches, but that one will also be on Zoom. And that presentation is our lunch and learns, typically our faculty presenting on some topic that we think would be of interest to other faculty and to community members. So that at that lunch and learn, we'll have Dr. Elise Eifert, who I just mentioned, and Dr. Meredith Powers talk about some collaborative work they did with the Junior League last year. And this was something that came out of the Growth Network. The Junior League contacted me, I connected them to Meredith and Elise, and then they carried out the project, which was, among other things, creating a pickleball court that is accessible to seniors. So they were going to talk about that process of collaboration and hopefully inspire some more. And that's November 17th at lunchtime, and we'll send out a notice about that. I wanted to mention also that I hope you enjoyed my spiffy email. I don't know, those of you who've been on the mailing list for a while may have noticed the format changed. And it now has all sorts of nice little buttons down at the bottom for a sign up form. So if you forward it to other people, they can click on that, fill out the form, and then I can add them to the distribution list. There's an opt out on there, which we're now legally required to put on such things at the university. And We managed to get in compliance before we were told we were out of compliance. Other people are going to find that out very shortly. And I was their guinea pig on learning how to use all of this software as an untrained faculty member. Let me know if you have any suggestions. That was a bare bones one. I'm getting really fancy now behind the scenes, learning how to do Photoshop and things for the banners. That's one of the reasons this meeting is taking place so late, this first meeting, because it took me a little while to figure out how to send out that email and how to, to get the list all in order in the right format and everything. So welcome to the new growth email system. There are a couple of other people on the call who are members of the Growth Executive Committee, and I want to shout them out. Chantal Caro is my colleague, not only a member of the Growth Executive Committee, Faculty Executive Committee, but she's also my colleague in gerontology. It's so nice to have two colleagues. Some of you remember when I was the only person in the gerontology program for a short time. And I see that Jackie Mayer is also on the call. Maybe she will stay blacked out because she's technically not on the executive committee this semester. She's been taking a little leave, but she's been literally hanging around anyhow. So we're grateful to her. There are other members of the executive committee as well who may or may not be able to stop in. It's a busy time of the year for faculty. We just got over a fall break and now we're panicked about the end of the semester. So I'm going to start by going around and asking those of you who notified me that you were interested in talking about opportunities for collaboration to do that. And then if there are other people on the call, and when we finish that, we'll go around and introduce ourselves more fully. Let me start out. Lisa, can you hear me?
Yes, I can. Hi, Rebecca. Hi, everybody.
Hi, this is Lisa Taylor, and I wanted to ask her to introduce herself and her interest in collaboration first, because I know she has something else to do in a while. But she's here representing Dr. Teresa Washington, who some of you know. She's on research leave, so I'm assuming that's why she sent Lisa in her stead.
That's correct.
So Lisa, would you like to discuss your project and what kind of support would be helpful to you?
Sure. Thanks again for the opportunity, Rebecca. I was here with you last year, and the last time we met, it was absolutely phenomenal. And I'm just glad to see everybody again. I'm also putting the information right there in the chat, so you have that. If you're interested in connecting, then Dr. Teresa Washington, she can be reached at that number, or either you can email us directly. And if you have someone else that is interested in the program, then if you have, in other words, if you have someone in gerontology, someone that's a senior, someone that's a kinship care provider that you would want or you think would benefit from the study, it would be wonderful. Some of the things that you need to know concerning the study is that you must be African American, must be over 18, also taking care of a related child, ages 5 through 12. That can be a grandparent, an aunt, an uncle, or a sibling. Taking care of a child, ages again 5 through 12. And you can also know that you can be a godparent even. It could be a church member. It can just be someone who's looking after the child. And then the participants will be asked to take part in an interview about the child's behaviors, health, and family. The total time, it's saying 60 to 120 minutes, but in all actuality, it's closer to the 120 minutes because, as you all know, if you ever get a senior on the phone or either face-to-face, when we first started with the program, obviously COVID, and even we were doing the pilot, and then after we were going either into the homes or meeting at the library or just meeting somewhere that would be conducive for them. And once someone starts talking and they're happy, then they most of the time, want to start just telling you a little bit more. So it's not that the interview process itself with the questions takes so long, it's the dialogue in between. But of course, after with COVID and the pandemic and everything, that isolation has been critical on not just our seniors, but on everybody. All of us have been affected by that. And by me saying that, sometimes somebody's just waiting for that phone call, waiting for that interaction, waiting for that social connection, if you will. So it could absolutely be more, obviously, than 60 minutes. But once they finish that, they will be compensated $50. They will be compensated $50. So, basically there's a team of us. So we have our lab there, and there's someone that's on, red cap there entering all the data. Everything is confidential. So if you have someone that you think would benefit from this, please let them know. We don't use names, we use ID numbers. I mean, all of you all, I'm sure with research, you cannot hurt the participant, but we make sure that their names are never given. That's never something they have to worry about. All their information. And sometimes, like I said, they want to get a lot off their chest. And if that is the case, they don't have to worry about what we're going to do with that. We're going to listen, but we're not going to take all their information and just, feed it to the world. That's not what we're doing. We're hoping that this will help them. This will help them with their finances, but it also will allow them an opportunity to be heard. Sometimes people take care of other people and they just want to be heard that, hey, I make a difference in somebody's life. Does anybody see it? Not to get accolades, but just so that you can know that people out here do need help and that children are hurting. So if we could collaborate together, if you have people that you think would be helpful, that it would help them, and that we could work together, I would be so excited. And I'm sure Dr. Tyressa would, as all the whole team would be excited for us to collaborate together. Thank you so much, Rebecca.
Oh, you're welcome, Lisa. I just want to mention Teresa has been a very active gerontology faculty affiliate. She's taken on, I know of 2, there may be more than that by now, but 2 undergraduate gerontology minors on her project. And they're amazing. Is it okay if I mention their names, do you think, Lisa?
I mean, I don't know. I don't know.
Well, I'm going to go ahead because they're amazing students. It's Nathaniel Rivers and also Angel Battle. They're both gerontology minors. And, I was delighted. Nathaniel came as a transfer student and had been cared for by his grandmother, and he just jumped on the opportunity. Because it was personally meaningful to him, the research. So,
oh yes, Rebecca, he is a phenomenal young man. He is a phenomenal young man, and he is doing a great job. Yeah,
well, I had no doubt, or I wouldn't have brought him up.
He's making you proud, that's for sure. And he always has, feedback, and he's really excited about the work. He is.
Okay, well, next I'd like to ask Roberta to talk about her new nonprofit. And I want to thank Chantel. Whoops, sorry. I was trying to unmute Roberta and I muted myself. But I want to welcome Roberta Byrd to talk about her new nonprofit. And I want to thank Chantel for inviting her. And Roberta said she found you, but I know you're good at finding people too. So go ahead, Roberta. Let's hear what you have.
Thank you for having me first and foremost. My name is Roberta Byrd. I am a transplant to North Carolina from Pittsburgh, Pennsylvania. And I resigned from my position as a Medicaid caseworker, where I specialized in Medicaid for individuals entering assisted living and skilled nursing facilities. And with that, having a background of having been a single parent to a 4-year-old and the primary caregiver of an 83-year-old father, I have working hand first knowledge of the health disparities experienced by older African Americans as well as by African American caregivers. So with that having been stated, birthed out of that knowledge and experience came Ruth and Naomi's House. We are at the very basic foundation of development. We have 3 people on our executive board. We are focusing on reducing the errors in the completion of government paperwork for, sorry, I'm in my car next to the train. We are, one of the duties or one of the areas that we're focusing on is completing government paperwork in the most efficient and effective manner so that there are no delays or denials of benefits that individuals are eligible for. Another focus is in regards to keeping older African Americans within their home, not necessarily participants in the PACE programs, but linking them to in-home services that they would be eligible to receive while addressing comorbidities and health disparities. Because a lot of times there's language that is used by physicians, social workers, nurses, and other medical staff that the older African American doesn't understand in regards to his or her comorbidities. And finally, providing caregiver support to African American caregivers, because the average age of an African American caregiver is 54. Their annual income is $10,000 to $15,000 yearly, and they also experience not being able to coordinate care, lack of self-care, and they're dealing with their own health issues. As we already know, there are many issues that go on in the African American community. So I'm looking to partner with researchers in regards to getting funding and servicing in order to service our population and make an impact, not just in Guilford County, but to take that, get it published so that it can be examined and we can be recognized nationally, because these are 3 specific areas. And we're not, in all honesty, we're not preparing for this surge of older adults that is getting ready to happen in the United States. And like I said, health disparities is a big, big issue in the African American community. So that's my area. We have a Facebook page, we have an Instagram page. I have to talk to my person in regards to our website development, but I can be reached at Ruth and Naomi's House, all one word, at Gmail. And I'll put all my information in, Lisa. I'm sorry, I'm in my car on my cell phone. But I'll put all my information in regards to contact so that we can work together and so that I can support growth, because I think that there's nothing better than all of us coming together. Scott and I had a wonderful conversation about clinical trials. So I'm excited. Thank you for having me again.
Right. And you know, Roberta, the fact that you're in the car has inspired me. I think that each of you who's interested in collaboration, Lisa and Roberta so far, should email me, if you're willing, a paragraph, and then I can send that out to the Growth Network. I know there were a lot of people who wanted to be here today, but it would be a way of getting that information out to a broader group of people. And so I'll send out an email reminding you all to do that, and then see if we can get that together. Okay, let's see, David Haynes, who I assume you're going to talk some about Trala.
Yes.
But I do want to mention that David Haynes is the only person who has sent me a birthday card, a real birthday card, every year since I met him. He's got a perfect track record. Not even my daughter has done that. So David is my birthday, my birthday man. And it does show what kind of a caring and organized person he is. So David.
Right. Well, thanks for inviting me on the call. I'm David Haynes, and I am a board member, and I'm representing the Triad Retirement Living Association, TRLA. We call it TRALA. This is a nonprofit type group. We've been around about 15 years. We have about 225 members here in the Triad area: Greensboro, the Guilford County, Alamance, Forsyth, Rockingham. Our membership is made up primarily of those serving seniors. We have many home care providers, medical home care providers, assisted livings, your retirement communities, your nursings, your memory care. We have Senior Resources of Guilford. We've got a few elder law attorneys. We have, of course, the School of Gerontology at UNCG. I specifically do long-term care insurance. I was in the senior home care industry for 6 years, so I know this industry very well. So our membership makes up what I just described. We meet monthly. We've got a newsletter. We have a lot of events. We do a lot of socials. We do a lot of charity work in the community, primarily for those in the senior community. So our effort is primarily to serve seniors. We have a great representation of AARP, the Alzheimer's Association. We're actually connected up training some of our members that want to get the CSA, the Certified Senior Advisor designation. A lot of our members have events throughout the month that are typically open to anyone. We do a lot of emphasis on caregivers. A recent group that just became a spinoff of TRALA is called ACAP, Adult Children of Aging Parents, ACAP. This is a group made up of adult children with aging parents. And at these meetings and formats and websites, et cetera, our members can gain a lot of information and knowledge on what do we need to do to care for aging parents. You know, most people don't plan, they react, and it's too late. Part of what I do with my long-term care business is I help families navigate those that have a long-term care policy. A lot of the adult children have no idea what a mom or dad bought 15 or 20 years ago until it's too late. So now I don't charge for that. I want to do it as a service to seniors. But so myself and so many others, Chantel is a member, Rebecca's a member, Elise is a member, Scott Witt's a member. We are to serve seniors. I will put in a quick plug. If you have never heard of Teepa Snow, Teepa is nationally recognized. She's a former occupational therapist, a great educator, 40 years of experience. I've heard her live a number of times, and she walks through the whole process of someone with Alzheimer's. From the time the program starts until the time it's over, you will see an incredible transformation of how Teepa plays out someone with Alzheimer's. There is a Zoom call, and I'm happy, I'll put in my information, but I'm happy to send you, it's a Zoom call in November that ACAP is promoting with Teepa. There'll be over 1,000 people on this Zoom call. If you've never heard her, it would be well worth your time to tune in. I mentioned TRALA, TRLA, Triad Retirement Living Association. Our website is trla.info, trla.info, and I'll put it in the chat box. But go to our website, scroll around some, you'll recognize a lot of our members. You're welcome to reach out to them at any time. And myself, I'm a board member. But we want to collaborate with many of you that have things where we can be of service in numbers that we can help promote what you're doing. So if I can be kind of that liaison between the school, I'm a former UNCG alum. I graduated in '82, and my heart really is helping support what UNCG is trying to do. And if we can be of service from any of our members, we are more than happy to lend a hand. So I'll put my information in the chat bar now, and reach out to me at any time.
I do want to endorse what he said about hearing Miss Snow. I heard her at the Southern Gerontological Society meetings a few years ago, and I was intending just to stay in the session for a few minutes, and I missed my next meeting and stayed straight through it. I was completely captivated. And at the time, my mother was still alive and had dementia. And even though I'd been teaching students how to interact with people with dementia for years, I learned so much in that session. It really, it was really riveting. So thank you, David, and thank you for the birthday card. I turned 69 this year, so next year I expect a great big one.
Yeah, okay. Thank you.
Okay, thank you, David. Let's see, Scott, I think you're next to talk about the triad clinical trials.
Right. Hey, and I wanted to reiterate what David had to say. We've been a member of TRALA for a couple of years, and it's a huge group of people. They meet for a big breakfast once a month when things are normal. Lots of great social events, lots of great contacts we've made there. It's I mean, it's fun and enjoyable, but it's good for business and the community as well. So everything he said is absolutely true, and I'm a little skeptical of these things. So my name is Scott Witt. I'm with Triad Clinical Trials. We are a medical research clinic based here in Greensboro. We're community-based and operated. The clinic's been around for about 15 years. We have a couple of well-known physicians that work here as investigators and take care of our patients. But we're about to launch several Alzheimer's clinical trials. Some of you may have been paying attention to the recent drug approved by Biogen, Aduhelm. These are in a similar vein. There's a lot of controversy, and rightfully so, around the approval and pricing of that drug. What we're working on will be alternatives to that therapy that may be better, should be better, and hopefully priced differently. But you'll be hearing from us more over the next year or two as these trials come online. But what we're looking for are two things. Number one, support from the community and contacts into organizations that deal with people who have dementia or Alzheimer's, because we do want them to screen for these studies. We have physicians on staff. These are NIH and FDA approved and supervised trials. We take very good care of these folks, but we need people in clinical trials to try these medications. We take very good care of them, and they're monitored very closely. With COVID-19, there's both been a rush to people to get into COVID trials, but other people have been a little bit hesitant to seek medical care of any kind. And we're dealing with the same thing, but it's very important that we get into the community. And to piggyback on Roberta's comments, we make a genuine effort to engage and reach out to the African-American community. It has been a historical wrong, quite frankly, in healthcare in general, but clinical trials specifically, that African-Americans and women, quite frankly, are underrepresented in the clinical trial population. And these medications work differently in people based on a number of things, but those are two big factors. Historically, Triad Clinical Trials has had about 60% female enrollment across all of our studies and 40 to 50% African-American enrollment. So we're known nationally for being able to provide that diversity. We were doing it before it was cool, but now it's cool. So I just can't overemphasize how important it is to get people in the community involved in finding people with these conditions. We'll have one middle of next year for people who are concerned they might have it, who are showing some early signs of dementia. We'll bring them in and give them some medical screenings, and there may be a therapy in development for them as well, which would make me very excited, because my wife tells me I'm showing some of these some of these signs. The last thing, and I think maybe very particular to this group, is we're looking for 1 or 2 mental health professionals to join the team on a part-time PRN basis who have experience working in the MCI or Alzheimer's population and have used a number of very common assessments. CDR, ACOGs, and MSE are bands. If you've done those and you're familiar with those, we'd love to speak with you. We're pretty flexible on timing, typically mornings or early afternoons. I have to tell you, I participate as a rater in some of these Alzheimer's studies, and it's very gratifying. You spend a lot of time with folks who are very concerned about their mental health and their level of cognitive ability. And we feel we're making a real impact in these people's lives and in the development of new medications. And those, of course, would be paid positions as well. So if you know of anybody who works in that population, we'd love to chat with them. I found my last 2 through David's group at Trala, so we're hoping to find a few more. But that and just people who are interested in joining these clinical trials. The trials are free. You're actually paid for time and travel. If you show up for an appointment on time, you'll typically throw in a Chick-fil-A gift card so you can get some lunch when you're done. People like that a lot. But for Alzheimer's in particular, it's really not about the money. For people to join these clinical trials, it's really about participating in a way to find a new therapy for this disease. All right, it's Triad Clinical Trials. If you Google us, we show up on top. I will put out some. I see a note from Lisa. Fantastic. I will put my contact information in the chat before I go, Lisa. That would be fantastic. And I'll do my best to stop talking. I'll put myself on mute. David knows. David's one of the few people I've met who can actually out-talk me. I am in awe of him, but I'm pretty good too. I hope everybody has a good afternoon. I appreciate your time. And I got to go get my sons from high school here soon, so I may have to drop off, and I'm sorry for that.
Scott, I can out-talk you too. I'm pretty sure of that. But I do want to comment on one thing you said that really resonated with me. When I started teaching gerontology.
We can't hear you, Rebecca.
Oh, why not? Huh. Oh, I'm good? Okay. I'm sorry if some of you can't hear me, but I'm not muted. So
Can't hear you, Rebecca. Can you guys hear Rebecca? I can't hear Rebecca.
who is that who can't?
I can hear Rebecca, Lisa. I'm not sure what's going on.
Okay, sorry. I don't see anything else I can do. I wish I knew sign language. I don't. But I do. I just wanted to mention, Scott, that when I started teaching gerontology at UNCG in 1984, I had to tell my students, well, this is what we know, but of course, we only know this because we've studied 40-year-old Harvard male graduates. And that was really, and you know, there wasn't much diversity at Harvard when they were doing those original clinical trials. So I remember pharmacists coming in and saying, well, we have no idea how drugs work. And, you know, someone who's not a 40-year-old white male with, you know, a degree from an Ivy League school. So the work you're doing is extremely important.
Thank you. We enjoy it.
Yeah. Chantel or Dr. Caro.
Hi, everyone. So I am here to share our spiel on behalf of Dr. Eifert, the graduate program coordinator. But it works because I'm the field instructor, and that's what I want to talk to you all about. So some of you know that we have a integrated capstone in gerontology. It is the final course that our MS students take in order to, what's that word, maturate from the program, to be all fancy. So our students, in this integrated capstone, students have to not only do a paper and presentation, but when it comes to all of you or community partners, they also have to do a field experience. Their field experience has to be between 80 to 100 hours. It's the first 6 weeks. We only ever offer the capstone in the summer session. So that might be also something to keep in mind, given work schedules or what have you. But students are afforded the opportunity to choose a research endeavor, to do an internship, to do a project at their own place of work. And so that's kind of what I'm sharing with you all about. If you think that you could use abled and skilled and knowledgeable future gerontologists and are interested in mentorship and partnering, our students are wonderful. I would love to reach out to you or connect with you. Students do choose these field experiences on their own, but every summer I get a few, or in the spring when we're in this process, I get a few, you know, not knowing where they should go or not hearing back from people. So since I've come to the program since last year, I've been trying to keep a little bit of a digital Rolodex of people that might be interested in working with our students for that period of time over the summer. I do also want to really reiterate that I understand that being a mentor in this capacity is time consuming, and that is something that you would have to really think about in terms of your own capacities and what you're working with, or the projects you're on, or your work schedules, especially in the summertime. But really the expectation for our field supervisors or research mentors isn't too huge. You know, there is a collaboration in the beginning to get the student going. The student presents the project. Hopefully we are teaching them and mentoring them on how to collaborate with our community partners. So this really is a reciprocal relationship. And then after that point, community or our field supervisors meet with the students only twice during that 6 weeks as like a required. So there's like a mid evaluation and a final evaluation. So I think that really the time demands can be really negotiated between you and the student and the project that's at hand. But many of our students are either early aging services professionals or professionals who've been in aging services for 5+ years. So we really span a pretty wide spectrum. And I would say that specifically for those early in their career aging services students and future professionals, future gerontologists, your mentorship is super valuable to them and to us. And so if you know of other organizations or projects or research that could use some able-bodied people and you're ongoing in the summer, please feel free to reach out to me. I'd love to just keep your name and contact in our file in case a student needs someone to reach out to. And if you want more information about the capstone, and we are putting together a new field supervisor handbook. It's only 2 pages, but that I could give you some extra information on. If you just want some more clarity, I'd be happy to send that your way. So thanks, everyone.
Right, and I do want to mention the students really take these projects seriously, and it's like having a temporary employee. The other thing I want to mention is there are other programs at UNCG that also need to place interns in various aging related places, and some of them with a particular bent to them. So if you have a need that for some reason, for an intern that for some reason Chantel can't help you with, do consider contacting me, and I might know of someone else on campus who needs to place interns. I just had a student ask me this afternoon whether I knew of a place, but he didn't get specific about what he wanted, an undergraduate, a psychology major actually. Matthew, did you want to say something?
Sure, I can give a little bit of a spiel here. My name is Matt. I am a postdoc in the psychology department at UNCG. I work with Dr. Dana Taran, who I understand wanted to be here today, but she also had some child care responsibilities. I think there was a soccer game or soccer practice or something that she had to get to this evening. So in our lab, we're looking for many healthy older adults. Typically, we look for 60 years and older for our research, which really runs the gamut of things involving what sorts of cognitive changes stay the same or differ as we get older. We're also looking at how people feel, how they think about their own state of aging, how they might be aging in their environment around them, how the environment might be impacting what it is that they do and what it is that how they act as they age. We're always looking for many adults who are interested in participating in this. And right now we're even running a study where we're asking older adults to carry around smartphones with them for 7 days. And we're finding that many of our older adults already have and use smartphones on a regular basis, but those who are interested in the study who may not have a smartphone already, we're using this as an opportunity to loan them a smartphone and perhaps even kind of explain to them and teach them how to use it so that they might be more familiar with this technology in the future. In fact, I had a home visit today. I went out to a potential participant and actually helped her set up a new Gmail account because we're doing everything remotely now. We're, with everything that's been going on the last couple of years, we've had to make a lot of hard pivots in our research. And we've able to run everything we do remotely with almost no contact at all between ourselves and the individuals, which of course right now is safer and healthier, but we really do miss bringing people into the lab and seeing them in person more often. I'm giving a brief overview of what my research is, but Dr. Taran's lab is even broader than what I do in particular. She's interested in a number of, interested in a number of what's called like metacognitive processes, or how we think about our own thinking and how we remember tasks, and these ideas that we might think that we're going to forget something, but actually we remember it, and how older adults can steer away from using their own memory when in fact they do have the capacity to remember new stimuli, basically. And as far as what we can do with that knowledge and how we can perhaps pass along what we see in our research to the community, let them know that, yeah, older adults are a lot more capable than some people think and some people feel, even those older adults themselves. So that's my little spiel. I don't know if I quite compete with everybody here as far as talking, but I could probably go on for if needed.
Thank you, Matthew. I had a hunch you would represent Dana when I saw you pop up.
Yeah, that's what I'm here for.
Yes, and Dana used to be on our growth faculty executive committee a while back, but she became an associate dean along the way, and it distracted her a little bit for a while. So thank you, Matthew. I think those are all the people who signed up in advance to speak, but Jackie, did you want to say anything about your research? I know you're on trying to keep a low profile, but do you have anything you'd like to share?
Sure, I can just say that, so I have an R15 project right now that is focused on older adults' physical activity and trying to understand the differences between people who struggle to be consistently active versus people who are consistently active. And so we're actually using smartphones, similar to what Matthew was talking about, smartphone-based assessments that we have older adults completing multiple times per day about their physical activity, their sedentary behavior, motivation for those behaviors, and then just other information about their, physical and social context, where they live, things like that. We're like Matthew was saying, we've had to switch to lots of stuff online. We basically do all of our trainings on smartphones and activity monitors with these participants online. Due to COVID, we started collecting data in January of 2021. We have almost 200 older adults that are enrolled in the study, which is awesome. That was our recruitment goal. And we're trying to follow these participants for a year to learn more about their physical activity over the course of that time period. So that's what I'm working, that's what I'm pretty much invested in right now. It's all consuming, but very grateful to have the funding, very grateful for a lot of the connections that we developed through the growth networking events. Yeah.
Thank you, Jackie. I love it that so many people are using the smartphone contextual analysis. I remember back when I was still in graduate school, and they would beep somebody. They would have beepers, and then they had to go to a phone and call in their report. This is much easier now that people have their own phone. Let's see, we haven't heard from Krista or Erica, and I want to hear from both of you before we get off the call. Krista is one of our undergraduate minors, but she's also been in the field for quite a while, so not your typical undergraduate minor by a long shot. And I just want to embarrass her and say last year she cleaned up in terms of winning awards at the university. She placed second place in the Research Creativity Expo in Social Sciences, and then she got the Library Research Award for the entire university for the same paper. And so she made us very proud. Okay, Krista.
Hi, everyone. I'm not sure what you want me to say. I just finished up my last day at the Chatham County Council on Aging this past Friday. I was working there in development and communications. And so while I was there, the research that was mentioned was around racial transportation disparities and the impact of those disparities on transportation access for older adults in Chatham County. So I'm really interested in what Roberta's up to. You mentioned Teepa Snow earlier. The Council on Aging, it's probably a little bit of a haul for everybody, but on November 10th, which is a Wednesday from 3 to 4:30 at the Northeast District Park in Chatham County, they are dedicating this respite park for caregivers of older adults with dementia and Alzheimer's and other chronic conditions. And they've made this special park for folks, and Teepa Snow is going to be speaking at that. So if you want more information on that, I can give that to you. And then currently I am working, this is not entirely gerontology related, but it is somewhat. I'm a peace and conflict studies major, and my senior practicum right now is with the Partners in Health and Wholeness, which is part of the North Carolina Council of Churches. And one of the aspects of what they work with is around healthy aging. And I have a program coming up that I'm doing that's going to be tying in, looking at some of the different health aspects that they're doing, but looking at it from a peace work lens. So seeing how this is the work of peace in helping with healthy aging, harm reduction, mental health stigma, combating mental health stigma. And if you're interested in that program, it has a faith bent, but it has secular applications. I can put yes, I will definitely be in touch, Roberta. I can put the link for that event in the chat. It's going to be over Zoom. And then I may be staying on with them past my practicum because they're wanting to redo their healthy aging resource information guide and all of that. So that is what I'm working on currently. And when I'm no longer there, they may need some more people for field work. So Chantel, maybe I can get you that information. I can get you contacts with the Council on Aging too with Chatham as well. So that's basically it.
Right, and let me mention, you could get someone like Krista if you placed one of our interns, right? Remember, she's an undergraduate and Chantel is promoting graduate students. So Yeah, our minors are an interesting and advanced bunch of students. Okay, one more person, Erica, and then we'll just open it up to general conversations. And Erica, it will be very interesting to hear from Fordham. I have a lot of friends who teach there, so I'd be interested in your reactions to what we're doing in Greensboro, in addition to hearing about your own interest in aging.
Well, I'm actually in Greensboro. I'm doing the Fordham's online master social work program. So I'm actually looking for an internship. And I never thought about gerontology or working with aging adults, but now I'm kind of interested.
So that's great. And our gerontology program is online, so you could just like blend them.
Yeah.
So, well, welcome, Erica.
Thank you.
I don't know what relative told you about us, but thank the relative, please.
I will.
Now, a couple of more things. We've heard from everybody now, and I won't keep you forever, but I do want to mention that we're trying to increase our social media presence. We've kind of had an organic division of labor among various people affiliated with the gerontology program. Frances Bottenberg, who was unable to be here today, started our growth YouTube channel. So I would suggest you search for that and subscribe to it, because that's where I'll post a recording of today's session. And there are recordings of past sessions up there. Next time, of course, we'll be focused on a presentation on a specific topic I mentioned by Elise Eifert and Meredith Powers. And there are several other dates throughout the semester that were in the save the date memo I sent out. And you'll get invitations to each of those as they come up. But also I wanted to plug the UNCG Gerontology Facebook page. If you're not on that, it's a great place to post, to ask for internships, to post the kind of information that you've put in the chat today, and so forth. And then also Chantal has been sending out Instagrams. I don't do Instagram, so you'll have to put in the chat how they can do that.
Putting all the things in the chat.
Okay, great. And then Elise Eifert started developing a LinkedIn page. So we're every place right now, either growth or gerontology, and we're kind of making sure we get information out there. So whatever your social media presence or participation, we hope we'll see you on some of those places as well. Let me see, is there anything else other than I'll just open it up. Maybe people could raise their hands if they want to ask somebody else a question. You know how to do that down there with the little reactions button. You can go up, or we're such a small group. Okay, Chantal, you've done it. So, you applauded. You didn't raise your hand.
Yeah, I meant to raise my hand.
Okay, well, I'll call on you then.
Shameless plug, sorry, 2 seconds, gotta do it. It's like in my heart. Krista, Erica, we offer a PBC if you don't want to go back to school for a whole other master's, and it's fully online. You can call yourself a gerontological specialist. Just saying, it's a credential. Just keep it in mind. Reach out if you're interested. That's my shameless plug. Actually, for anyone on the call too, but just in case.
Right, and believe me, Krista's been pressured by somebody else already. Does anyone else have a question of anybody? I think you'll be able to go back to this call once I get it posted. I've never posted to YouTube. This is going to be another technological notch in my belt. Is there anything else? Well, it's been really.
I've got one.
Okay, David.
Well, just a last minute thought about our Tried Retirement Living Association group. Many of you do not know, we allow students to be a member of our group. It's only $25 a year for anyone in a university or collegiate setting in the field of gerontology. You can be a member of our group, and this gives you a lot of access to our members, a lot of events, a lot of educational, a lot of symposiums. And we've had we've had quite a few of UNCG gerontology students become a member. And that is absolutely invaluable to start segueing into, the working community. You never know who you're going to meet in a situation like this that can further your career. So I just kind of throw that in as a plug.
Right, and I would suggest that all of you, I will send an email out to the growth membership telling them, maybe rather than try to collect information from all of you, I will mention that this session is posted on YouTube and people can look at it there. That might be less onerous, but I would suggest that if you are on Facebook or know someone who's on Facebook, that you post that information there, particularly that, David, because a lot of our students join that Facebook page. And I have a question for you, David. Do you have, do you think you'd be willing to send out membership recruitment for growth to Trala members, to your email list in that digest you do?
Oh, yes, absolutely. Happy to.
Okay, well, I will make up that. I'll put that on my to-do list for the semester to make up an email for you to distribute. Because now that I know how to do this better, I want to go on a membership drive. Roberta, you have your hand up.
So I just wanted to say, with everyone's information, links to all your research and everything, I'll be more than glad to post that on the Ruth and Naomi's House IG, as well as our Instagram as well, to attract attention and membership and anything. And I just ask that you have folks follow back, because we're in this age of everybody needs a follower. We need to build up everything. So, but I'll be more than glad to share the information. And because fortunately and unfortunately, I have people from across the country. So folks from Texas all the way to the East Coast would be looking at that information. So I'm glad to share.
And that, it's important to mention that now that the gerontology program is fully online, we're going to need community partners all over the place. And we have alums all over the place, but it's always good to have more connections. I have a feeling, Roberta, that David is going to be on you to join Trala in a matter of seconds after this ends. She's got the Trala spirit, I think. Anything else? Okay, well, thank you so much. And maybe we'll do this again later in the year. Would people find that helpful? It could be, maybe sometime next semester when things have had a chance to develop, and at a time, maybe we can find a time when more people are free to attend. But this was excellent. I appreciate the spirit of collaboration and the commitment to serving older adults one way or another, directly or indirectly. And I just look forward to seeing you all in person when we think it's safe to do that and advisable to do that. And just know you're appreciated. So thank you.
You are too, Rebecca. You are.
Thanks, everyone.
Thanks, everybody. Bye.